What we wanted to do is maybe explore some of your practice in terms of Ring Chromosome 20 diagnosis, the differential diagnosis that goes on. What makes it so unique, and what you're looking for as a medical professional when you're looking to diagnose a rare epilepsy disorder?
Ring chromosome 20 is unusual because it typically presents as a difficult to control epilepsy in children who've otherwise been completely well before their epilepsy starts. So it typically starts in the early primary school years in children who've been doing fine in school, their parents have had no concerns about them, and then they may begin with a pattern of having occasional seizures at night time, which may take a little while to recognise as seizures because they often look like the child is just rising up from sleep or sitting up in the bed, and then it may develop over sometimes weeks or even months into a much more difficult to control seizure disorder, with seizures characterised by what we call generalised tonic-clonic seizures, where the child may fall and jerk all over, or where they may lose consciousness. But there is one clue in the type of epileptic seizures that these children present with. Often they'll begin to have focal seizures which are characterised by extreme fear at the onset, and so the children look very, very frightened, and afterwards they may describe visual illusions or hallucinations, and these may be quite scary things, like for example seeing your arms bleeding, or seeing sharks swimming around the roof of their bedroom.
So this is very interesting, isn't it, that these hallucinations, because some people say, oh, maybe are they seizures, are they not? Or is this something different? Is this something that's unique to Ring Chromosome 20?
I think it's a very unusual type of seizure presentation, so I think whenever you see anything like this, you should be thinking about Ring Chromosome 20 syndrome, because we see it exceedingly rarely in other types of epilepsy. And I think this is an epileptic seizure, so it's due to an abnormal electrical discharge in a part of the brain which generates visions. So the child really feels that they're seeing something that's very frightening. So it can be these illusions of being cut, or sometimes they see monsters, and occasionally they may even see big holes with fire coming out of them. So I've had a patient like that in the past. So it's one of the clues to the diagnosis.
And so when you're making that diagnosis, is there a particular test that you look for?
Well, there are other patterns that give you a clue to the diagnosis. One of the key patterns is on the EEG, and doctors who can recognise a particular EEG pattern, which is a pattern of what we call slower waves, or waves in a rhythm called a theta rhythm at the front of the brain. And these can often go on for prolonged periods, these sharp and slow waves at the front of the brain. And then we would think about doing a definitive diagnostic test, which would be a genetic test, and this would be to look at the chromosomes. Now, the old-fashioned way of looking at the chromosomes was looking at what we called the karyotype, which was the pairs of all the 23 chromosomes. Now, one of the advances in medicine is that we have a new way of looking at the chromosomes, and this is called array CGH. Now, unfortunately, although this picks up many more of the chromosomal disorders, it cannot detect Ring Chromosome 20.
So this is a very important feature, isn't it, of the modern technologies that is being used in genetic testing.
Yeah, so often we will lose, even though we get advances in one area of medicine, sometimes you lose something, and one of the things we lose is this ability to make the ring diagnosis. So if you really think the child has a Ring Chromosome 20, you need to ask for a karyotype test, an old-fashioned test. And also the key thing is you need to make sure that they look at enough cells, because sometimes children with Ring Chromosome 20, or very frequently, they have what's called Mosaicism. So the Ring chromosome is not present in all their blood cells, just a percentage. So if it's only present in 5% of the cells, unless you've looked at enough cells, you might miss it.
So how many cells do you think are key to be looking for?
The lab, typically labs will look at about 30 cells, but that's not enough for Ring Chromosome 20. So if you still really suspect the diagnosis and they've not found it, then you need to ask them to go away and look at 100 cells at least.
So this is really, really a key key part of the differential diagnosis in terms of what you're looking for with this disorder. So, is there anything else that you're thinking is useful for practitioners to be aware of, even from a pediatric perspective? Because you mentioned that they appear completely normal up to the age of 4. So,
I think the other key thing is that often with the presentation of the epilepsy and the frequent seizures and the EEG abnormalities, many of these children may lose some of their previously acquired skills and may fail to learn as well as they did in the past. So it's really important that they get good neuropsychological assessments at the beginning of their epilepsy, and that continues to happen, and that they get the appropriate support in school and education to make sure that they're getting the appropriate help to achieve everything that they can do.
So does that mean that you'd get a child psychologist involved?
I think very early you need to get a child psychologist, and specifically a child neuropsychologist who has some expertise in epilepsy and understands the impact of epilepsy on learning and behaviour. And then not only just assessment, but helping manage children's learning and behaviour problems.
Well, thank you so much, Professor Zuberi, for sharing that with us. I'm sure that's going to be very useful, not only for families, but also for medical professionals as well. So thank you very much, Professor Zuberi, for joining us at this conference. Thank you.
Thank you.